almost a year ago, they declared a state of emergency relative to the government of Guam's financial management system. And I believe it was the chief procurement officer had declared it, and then they took the procurement and they put it over at DOA. But we haven't heard anything, and it doesn't look like we're going to be getting anyone from the administration on the link. So we'll find out, though. We'll find out. But how's that? Only on Guam can you have a emergency procurement last a year. It's 7:38. Let's go ahead and go back into the KUAM News Zoom room, where our good friend Dr. Peter Lombard is standing by, and he's been coming on, since this show was called Containing COVID, and he's been crunching COVID stats. We just had a great presentation from Public Health yesterday. So good morning, Dr. Lombard. Thanks for joining us.
Good morning, Chris. Good morning, Bree.
Good morning.
Jason.
And we're going to go ahead and do a screen share. We're going to turn it over to the doc. He's got a little presentation, and then we'll fire a bunch of tough questions at him.
All right, got a few slides for you today. Hopefully it's not too boring for you. I'll get through it quickly as I can. Real quick, you can see where we are. Last time we spoke about 3 weeks ago, we were sort of starting this down, the downslope here, but as you can see, we've certainly plateaued and maybe even gone up in the past few days. This is how we compare to the rest of the world. So Guam's up here in our per capita cases per day. So you still see we're not performing very well, and certainly one of the worst in the United States. So to borrow from Dr. Pavetsky's slides that she presented, I did want to highlight one of the more worrisome features is that our test positivity is still quite high. As you guys know, 13% indicates we're not really doing a great job of suppressing the community transmission. This surge is not improving with the test positivity. We want to see that coming down. The other thing you see here, which maybe is a hopeful signal, is that there is a slight trend of these cases decreasing. And hopefully that will continue and accelerate. But again, we've got to figure out a way to somehow make more of an impact on the community transmission. Another thing I wanted to highlight from our slides was this proportion of cases that are breakthrough cases. You're seeing 45% of the testing, and if you look at the JIC report, the hospitalizations about still 30%. We've been really consistent in that 30%, and every time I'm going to highlight, this is going to increase. So the orange proportion on these bars is going to get higher and higher as we get more and more vaccinated, and it's not a cause for alarm. When you look at other places that are more vaccinated than Guam, this percentage is higher than Guam. Same for hospitalizations, same for deaths. The percentage of deaths right now in Guam that are breakthrough cases is 12%. In places that are better vaccinated, it's getting up to 30%. And again, it's just a matter of how many people are remaining that are unvaccinated versus how many out there are fully vaccinated. This slide she showed, which I thought was pretty interesting, and I think you guys have been following the data pretty well, and I don't know if this was intuitive to you, but why are we seeing more breakthrough cases in the younger age groups? Intuitively, well, wouldn't it be the people that are older with more comorbidities? So, but I think you can also realize that the younger groups are the ones that are more likely to be exposed in the community. They're the ones that are out and interacting with one another, and we know from the age breakdowns that she shows us as well that the younger age groups are the ones driving the infections. I think a key point here is that the elderly are actually doing a pretty good job of protecting themselves by isolating and doing a better job of social distancing than the rest of us, wearing masks. And I think and that's the reason why a smaller proportion of the breakthrough cases are in the elderly, even though as you get older, your comorbidities are going to increase. So I thought that was something worth mentioning. So we're seeing more and more data come out about the waning immunity. And this is the chart here shows over 4 months. The waning immunity, purple here is delta. So you can see as you get to 4 months that the immunity, the effectiveness against infection, not severe disease, just getting infected is waned to close to 50%. And this chart over here shows 4 different studies which are showing the same trend. So as you get to 4 to 6 months, you're getting down into that 40 to 50% range. And again, we're in Guam. My first dose was in December, so we're like 10 months out. So if this slope continues, I don't think it's unreasonable to say that the effectiveness against getting infection at all maybe 30 to 40% by now. And so even if it's 50%, it's still protective. I'm half as likely as somebody that's matched with me that's unvaccinated from getting infected. But I think that's also why you can see how the vaccinated population are still contributing to the current surge that's out there right now. So thankfully, the same studies looking at severe disease protection is still very, very good, but waning. We were seeing 90 to 95% effectiveness. Now we're getting down into the 70 to 80% range. So if this continues, and I hope it doesn't continue that much, and certainly with the booster, both of these metrics are going to improve, but this will contribute to hospitalizations and deaths even amongst the vaccinated. I thought this was an interesting chart to show. So, this is one of those plots that I think it's hard to imagine how somebody can look at this and not believe and that vaccination protects you against death. If you look at the grouping of states down here with the best vaccination, their population deaths, this is just in the past month or two, the number of deaths in the last month or two, they're around 15 deaths per 100,000 versus this group up here, Mississippi, Louisiana, Alabama, Arkansas, with a much less share fully vaccinated, their deaths are over 60 per 100,000 residents. And that's just in the last 2 months. So if your state is better, has a higher vaccination rate, you might see a quarter less deaths. I mean, and that's just a huge number. And so I don't know how you could possibly look at this data and believe that vaccinations aren't helpful or useful. And there's many reasons for this, and it's just not just the fact that you're preventing against severe disease and illness, you're also helping to prevent the community transmission, because vaccination does help decrease transmission. You still can transmit and get COVID, but it's decreased if you're vaccinated. So I think this shows it nicely, but it also shows if you crunch the numbers for Guam, if you look at the deaths we've had over the last month or two, we're sort of an outlier when you look at the states that we are more matched to with regards to population vaccination. We're seeing quite a few more deaths over the last month or two. So, we've talked about that a little bit last time, and I know you guys are asking those questions, why is this happening? If you look at our life expectancy, we're actually not that bad, about 15th in the U.S. with regards to life expectancy. And even though we've had quite a few extra deaths recently, if you look at the deaths in Guam since the start of COVID, we still fall out pretty favorably with regards to the other states. But if this continues to increase, we're not going to be performing as well comparatively. So I definitely think there's something to say about the diabetes prevalence here. Maybe access to care. I heard some of your guys' comments on access to care in the past few days. But I think a bigger part of this is related to the waning immunity. And I wouldn't be surprised if you start to see the same kind of explosion in cases in other states as they get further and further from the vaccination dates, unless they can quickly get the boosters in. So here's a really great example in the world. Singapore, what's going on in Singapore? 83% fully vaccinated. That's just phenomenal. They're like, one of the world leaders here. And look at their cases. So this is, you can't say Guam is unique in terms of what their cases look like. There's definitely places like Singapore with high vaccination rate where this is happening. And you can see how this is how Singapore compares to the rest of the world. So their cases are increasing, but if you look at their deaths, their deaths are still a little tiny blip. So again, the cases, even though the cases are increasing, they're still being protected from deaths, and that's important. And if you look at their hospitalizations, now they're up to a full 33%. I'm sorry, a full 50% of their hospitalizations of the people that require requiring oxygen, they are fully vaccinated, 50%. And of their deaths, again, 30% of their deaths are fully vaccinated. So I think that's what more and more places are going to see as more of their population gets vaccinated. I wanted to show this slide too. This is the cause of death in Guam that Dr. Popetsky showed, and I think some people have a tough time wrapping their heads around this, and I do too, for that matter. I don't feel like I've got a great grasp of how cause of death I've seen the death certificates, and I know they got that part 1 on there, and if it's listed in the part 1 as an underlying cause, it's going to show up here as a primary cause of death. And you can see, as Dr. Lubatsky showed, COVID was number 3 in 2020. And I think for context, well, how does that compare to the United States? So I pulled this from the web, and our numbers: heart disease, cancer, neoplasms, COVID. So and the proportions are fairly similar. So what we're seeing in Guam is not super unusual here with regards to how we must be doing something right with how we're recording COVID deaths, at least compared to the rest of the country. And the rest of these are fairly similar as well too. We do have a little bit more of this nephritis. The kidney disease in Guam, due to the high diabetic burden, is a bit of an outlier in Guam compared to the rest of the United States. The other thing I wanted to compare was 2019, just to see these side by side. The numbers are similar for non-COVID deaths. So what we're not doing is mislabeling normal heart disease, normal cancer deaths as COVID. I think that's important, because I think I hear that and see that, oh, that COVID death is not as true. COVID death is probably something else. And I don't think that that's true. And if you look at, the deaths that we had before COVID and then after COVID, you can see how those numbers are consistent. And this came out this week. This was a study that they looked at 150,000 people that recovered. They didn't die, but they recovered from COVID. But they followed them for a whole year. And they only looked at cardiovascular events and cardiovascular disease. And this was dramatic. I mean, there was a tremendous increase in the number of people that have dysrhythmias like atrial fibrillation, myocarditis, ischemic heart disease, heart attacks. So, even surviving from COVID is, this long COVID thing is real. And we're going to get more and more data about this as time goes on. But, this highlights the point that, getting COVID naturally is still not preferable. Vaccination is going to very likely prevent you from these types of complications, and we'll start to see that borne out as time goes on. Also in the news, I think you guys probably seen, you may have even covered some of this, Merck's coming out with a pill. They've applied for EUA. In fact, they stopped the trial early because the results were so dramatic. And this is a pill that we'll be able to take before you're sick enough to require hospitalization, hopefully. And unfortunately, it's quite expensive, and this is subsidized. This is the subsidized cost. But hopefully this is something that's available to us pretty soon. Also, this was just last night. I don't know if you saw this, but the Pfizer finally requested formally the EUA for kids. They're going to meet, I think, on the 22nd to review this data. I was thinking maybe by Christmas, but this might even be before Thanksgiving or even before the end of the month, that the EUA is approved for children 5 to 11. And I think if you look at the numbers of kids in that age range, I can't believe that they're over 10% of the total population. And if we still have roughly 50% unvaccinated, that may only represent a third of the remaining unvaccinated Guam, but that's still a pretty good chunk. And I think there's a lot of folks looking forward to this. I think that it will help to keep our schools open and keep the kids learning face to face. And of course, it will, if we get that full 10%, that's an extra 10% on our total vaccinated population, and that's going to help us. Also in the news, other places, LA is requiring vaccination proof to enter certain areas, similar to some of the things that the governor's done here. I don't think those measures are going to help much in the midst of the surge, by the way, but if you are able to break out of the surge, then those things may make a little bit of have a little bit of an impact. This was really big news this week, and I think it needs more attention. I look forward to us getting rapid home testing. These are antigen tests, which were recently, the government recently used $1 billion to invest in this to distribute out to the states. So I hope this becomes available. This is like, we'll have to pay probably $1 or $2 per test. But if you can buy and you've got, 20 of these at home, you wake up and you've got a little scratchy throat or a little bit of sniffles, and you can take this test. It's not going to be as sensitive as PCR, but what it will tell you is if you're infective, and that's critical. If you're infected to others, and if you take this test and you're negative today, you're not infected at the moment. Now, you might turn infected tomorrow, but you can take it again if it costs $1. So I think if you have a bunch of these in your house, you're going to be able to rapidly identify whether or not you're positive and infected to other people, and you'll be able to self-isolate right away rather than having to not know, maybe go into work, ask your boss what you should do, and then there's a couple of days of not knowing what to do, and then you got to drive out to the testing site, waste a few hours doing that. So I think this is huge, and I think this is gonna help us a lot down the road. As you guys probably heard, New Zealand had the zero COVID strategy. They're abandoning that strategy because the Delta has had such enough of an effect that they're realizing that it's not going to be possible to contain completely. Doesn't mean that it's a failure of what they're doing. It's just a realization of where they are. And thankfully, their vaccinations are improving. This is kind of the stuff I see on Twitter. These are two different doctors, and one of them is much more of a COVID skeptic. He ran this poll and said, which is more dangerous, COVID or COVID vaccine? And the people that follow him said we're more likely to vote 63% that they felt the COVID vaccine was more dangerous, which is just insane to me. So another doctor posted the same exact poll, and 97% of her population of followers said that the infection was far more dangerous. And so this shows this is the echo chamber. You sort of people follow who they believe aligns more with what they believe. Now, one of these has to be more true, and I really have a hard time understanding how people can believe this, but they do. Sorry. But they absolutely do. It's totally insane.
Yeah, I'm looking at our comments right now, Doc, and yeah, they do.
Yeah, so this is the last slide. Just we've definitely peaked. Thankfully, we came close, but we didn't overwhelm our inpatient resources, and I don't think we will at this point. But we've plateaued, and we still have a high positivity rate. So deaths are going to continue to occur, and if the cases don't go down fast, the rate of deaths that we've been seeing the past few weeks is not going to go down very fast. It's still mostly the younger age groups. I think that boosters and getting more people vaccinated, these are the things that the Chima was saying. Of course, these are going to help, but again, you guys keep asking the question: what are we going to do differently now? Can we do anything differently now? And I feel like the answer is we're not going to make any changes. So
yeah.
So it is a little bit frustrating to hear that we're just going to ride this out and accept that these deaths are going to come. And to some degree, I can understand this. We're transitioning to this endemicity, and we just have to live with what we have. And for me, the pandemic is over when you have the sniffles and you just continue to go about your day like we did before. And I don't think we're anywhere near that yet. But
yeah.
Realistically, we've still got 50,000 more people that are still unvaccinated in Guam. Now, if you consider that a large proportion of those have actually already been exposed and have recovered from that, it's probably over 50% of them. So that might only leave 20 to 25,000 people only that are unvaccinated, but they're obviously still contributing to community transmission. And if you look at just the fatality rate, if all those people were to get infected, a pretty large percentage of them will succumb, unfortunately. And that's the endemicity factor. How long, over what period of time are those people going to die? And that could be 80 to 100 more people still. The deaths will continue unless we do something differently. Is a circuit breaker sort of lockdown? Is it? That's a tough call. I don't think it's going to be met well in the community.
Doc, I disagree.
If it's done, the messaging and the rationale has to be there. Maybe with the holidays, it can be an abbreviated circuit breaker lockdown. But there's got to be something. Part of the reason why our contact tracing is completely failed is because there's just too many cases out there. We didn't prepare for this type of surge. We didn't know it was going to happen. But I don't think we should abandon it. And I think that looking at how the plateau is going, I think that we're wasting time by not trying to bolster the contact tracing so that when the cases do get down to the point where it's more manageable, that we are able to suppress further surges. So I think that's one area that we could still be focusing some attention. And then, further down on the horizon, the rapid tests are going to help us, the new Merck medicine, getting the kids vaccinated, and then still reaching more of the unvaccinated. And I don't know how many of the unvaccinated that have chosen not to that would ever change their mind at this point. A little bit of reverse psychology. I don't think we'll ever change their mind. Despite the data and despite the fact that they'll be protecting themselves and the community. And so it's a sad reality, but I just think that's where we are. So So that's it. What do you guys have to think?
Oh gosh, I don't even know where to start. I will just start near the end here, where you talked about how we keep asking the same question: what can we do differently today to help stop this surge? And you sound very frustrated, Doc. Last time you came on, you expressed similar frustration on why we weren't really doing anything in addition to what we already are, because it's clear that this is not working. I mean, and I just don't think it's acceptable to. And I don't know if allow people to die is the right way to put it, but yeah, I just don't know.
I'm just confused because the vaccination rate it's 88.7, and
Of eligible.
yeah,
Yeah.
I just don't understand. I mean, we keep talking about getting vaccinated, but there's so many people that are vaccinated right now, and then you hear about the breakthrough cases. And the only thing that we should be doing really is, go get vaccinated and wear your mask.
Yeah.
And, the restrictions, not even sure, what is it, 10 for indoor gatherings of just vaccinated?
Yeah, 25.
25 outdoors, just vaccinated. And if you want to go to a restaurant, you got to be vaccinated. And what is it they say that if you continue to do the same thing, you're going to get like the same results?
Insanity is,
right?
Yeah. That's that insanity
The
quote.
definition of insanity is to
if
do
you-
the same thing over and over and expect a different result.
Yeah.
So, Doc, I mean, when we ask that question, and to me it's basic, because I don't know how public health can look at these numbers over the last 11 weeks, or the governor, anybody. How can you look at this and say it's working? Because when we ask Chima, what do we need to do differently? He says, oh, it's working. Wear your mask. And I just feel like an idiot because I just don't think it's working.
Well, it's I don't know. Working is they're basically accepting that this is the price that we have to pay to get through to a better place. And I guess I'm a little surprised that they're not offering anything new at all. I mean, it's just the same. Oh, keep social distancing, keep wearing your masks, keep trying to encourage more vaccination. And absolutely, that's absolutely true. But there's been nothing new, whether it's some new, I don't know, maybe they have some stuff in the works that we don't know about, but they definitely seem to be willing to just keep watching this plateau and slow decline and just accept the fallout from that. And, these DOAs are going to continue. There's no way they're not going to continue with the cases being at the level that they are, and the number of unvaccinated we still have out there that haven't been exposed. These deaths are going to continue at a similar rate. They'll come down slowly, but that's what they're basically what we're accepting by not doing anything. And I put myself on that side, and I've said, okay, well, to some degree, yeah, we are going to have to live with this. But what is the rate of death and that we're going to be okay with? I mean, is it if 100% of Guam is vaccinated right now? I've done some theoretical number crunching. If 100% of Guam is vaccinated, I still think, based on the waning immunity from the vaccine, I still think we'd have 20 to 30 cases a day. I really do. And a small percentage of those will be hospitalized, and a few of those will die, but the death rate will be very, very low. Let's say it's a couple a month. I mean, is that enough for us to tolerate, to say we're gonna start living back normally again? That's a tough question. I don't know. I mean, we've got now 50 kids in the U.S. dying a month, and kids, of course, dying is a much bigger deal. So, how many kids are we going to accept dying per month or per year? What kind of changes are we going to be okay putting on ourselves in the long term as this does become something that's endemic? So I can understand that school of thought, at least, but the rates that we're seeing the people die right now of COVID just seem like I think we should be trying to stop the current rampant, uncontrolled spread that's going on out there. I mean, and it's everywhere out there right now, everywhere.
Doc, I can't believe that. I mean, you just sound so common sense and reasonable, but I mean, total opposite from what we're hearing from the people who are running this pandemic response, from Dr. Berg saying that the spread is a side thing, and that natural immunity and letting the virus run rampant is not far off from what their plan is. When we hear public health say that nothing is going to change, I just got to say you're absolutely right. There is a point where you can accept your losses, but this is not that point. The losses are too great. The stress on the healthcare workers, the frontline workers, who we are just so intent on, protecting. They're losing sleep. We've been to the hospital. We did the tour. The healthcare workers are saying, "Hey, we can't sustain this." And so you're right.
Yeah.
I don't understand why we're not doing anything different. But thank you for saying that, Doc. I'm getting a lot of messages from nurses and some doctor friends who are just really grateful that you're on here saying those things. So thank you.
Thanks. Well, I hope, to be fair, I don't think anybody expected this. Again, nobody expected this surge, and especially nobody expected this to not start coming down faster. I mean, again, a lot of other states have come down from the Delta surge much faster, and we're just not seeing that here for probably a variety of reasons. And I think that my guess is that the PAG and they're looking at and are just shocked that the numbers are not coming down faster, and I think they probably expected it to happen more quickly. So, but you got to deal with what the cards you're dealt, and if you need to change plans.
Yeah, I mean, 11 weeks into this thing, Doc, I think that that ship has sailed. Where you can say they're just looking at it and they're freaking. Well, it's been 11 weeks of the same thing, and we're in this pandemic, and I just feel like we should always be at a footing where we can move quickly, and it should not take us 11 weeks to do nothing. Dr. Lombard, thank you so much for coming on this morning.
Thanks, Doc.
Thanks, guys. Have a good weekend.
You too.
Take care, Doc.
It's 8:03. Let's go ahead and jump over to KUAM TV, where the show will continue. This is The Link. Good morning.